Namaskar. Greetings from AIPH University. In the midst of the current coronavirus pandemic and crisis, we all have seen the central and state government take extremely important steps to contain the spread of the virus. But more remains to be done, and I want to emphasize three key points today. First is the importance of laboratory testing and surveillance. We now know that there is evidence of community spread of this infection, which means there is person to person spread within the community and not just from outsiders. And the way we count cases now is when they show overt sign symptoms and they are really sick, and samples are taken, and after a few days the samples come back showing positivity, and we say that okay, these are the number of cases present in that particular community. But we must remember that in the beginning phase, this disease is silent. What it means, in the first 2 to 14 days of life, the individual can be infected, will carry the virus, will shed the virus and infect others around him or her, but will not show any sign symptoms. So at that point, which is very critical and a long period, we have to catch all those cases and stop them from infecting others. And the only way to do it is by doing active surveillance and doing laboratory testing on high-risk groups where we think that there may be infection floating around, and give the test to many more suspected patients that may have the disease. I know currently we do not or may not have enough test kits, even enough laboratories around the country equipped to do the tests, but this need has to be bolstered in the coming days or weeks latest. The second important point I want to make is on hospital preparedness. Many hospitals set aside isolation beds, isolation wards, but we must ensure that there is enough personal protective equipment, meaning N95 masks and gowns and gloves for our doctors and nurses and healthcare providers to wear while providing care to these patients. We cannot afford our healthcare providers to become sick in this critical juncture. Finally, to protect the public, we must ensure that the spread is stopped. In fact, this is in the hands of the public, hands of every individual, every citizen, and I urge every citizen of the country to take this very seriously. And the important aspect of it to understand is, although it is critical and it is the need of the hour, it is extremely simple. Stay home, stay inside, and be vigilant. That anytime you see a case, suspected case, please report to the health authorities. That is the best service you can do to our country at this time. And I am confident that an intelligent country like ours will be able to contain the virus before it starts taking a toll on us. Thank you.